Hi, this is Dr. Mohan M R, consultant orthopedic surgeon and medical director at Nano hospitals of Bannerghatta Road, Bangalore. Protection of the knees during cycling. Cycling, the first and three most important factors would be the posture or the position you put into in your bicycle. Okay, the most important three adjustments which you have to make it during cycling to protect to get into a perfect posture without putting undue stress on any of the parts of your body. It has to be the fit of the bike. The most three important factor would be the saddle height, the height which will not put too much strain either on the hip or the knees. So the best guide for a height of the saddle would be you keep the particular leg, the right or left, in ipsilateral leg in a 6 o'clock position. It should make a slight hip flexion and slight flexion at the knee. The next important factor would be the saddle layback. If saddle layback is too forward or backward, so it puts undue pressure on the knee and you will likely to get knee pain. So for the best thumb rule for the saddle layback would be to, if you put the saddle bike at pedal at 3 o'clock position, the plumb line drawing from the knee to the toe, it should make a straight line. Okay, there should be a plumb line. The third important factor would be the handle reach. The handle reach you should be able to adjust in such a way that you make a 45-degree flexion at the hip and 90 degrees at the shoulder joint. So these three things are taken care. The injuries related to overuse can be reduced. So basically, it puts in all the hip, knee, ankle, your shoulder, your trunk, everything in a biomechanically advantageous position, so that when it put into a biomechanically advantageous position, so that you can pull along for a longer period of time. The other important factors which will be about the fitness. So cycling is not just about only the knee or the hip or the foot or lower limb. During the cycling, every part of the body is also put into action, basically in stabilizing the pelvis and the spine. Whether it can be gluteus, the pelvic muscles, or the spinal muscles, or the shoulder muscles. So the general fitness also has to be taken care. The other thing would be nutrition and the hydration. If you can take care of all these factors, most of the overuse injuries can be avoided. And if you are getting into serious cycling, better you take an opinion biomechanical person, either from an orthopedic surgeon or an exercise physiologist, basically a person with professional experience in telling you about all these sports related injuries. Thank you.